Kenyans with blood disorders will no longer have to travel out of the country for bone marrow transplant. This is after the Nairobi West Hospital began offering the services, with the first patient having undergone the process.
It was the country's first bone marrow transplant. A 55-year-old female patient who had multiple myeloma underwent the procedure on the 10th of October and is expected to be discharged from the facility in a few days.
So we'll talk about our first patient, which is a patient of multiple myeloma. And broadly speaking, there are 5 steps of transplant. In first step, we mobilize. So what is mobilization? In mobilization, we give some injections so that good cells are mobilized from patient's bone marrow to blood. And in second step, we harvest. So in harvest, we, with the help of a machine, we take out those good cells and preserve them in a bag. And in third step, it is called as conditioning. So conditioning involves giving high dose chemotherapy to the patient so that all bad cells, they die. And fourth step is transplant. So with conditioning, many good cells will also die. So to prevent damage, the good cells which we have preserved in harvest phase, it is given back to the patient.
Contrary to popular belief, this is not a theatre procedure, but a bedside procedure.
This is what medicine does lately. You take a drug that can target your marrow, you stimulate that marrow to produce the cells that are of interest to you. And the cell of interest is the stem cell. So a stem cell is a young cell that has not decided what it is going to be. So you can actually stimulate the marrow, you get the stem cells to start flowing in your circulation. And you take that blood through a machine, spin the blood. When you spin blood using centrifugation, as a procedure, you can layer blood out into different layers and you remove what is of interest to you. So using technology, we can actually harvest stem cells by just passing your blood through a machine. Then you harvest what you need. What you don't need, you take back to the person.
The hospital said it hopes to perform 70 to 100 bone marrow transplant procedures in a year.
Earlier the better. This is a dictum. So we should try to offer transplant in as early a stage as possible. So that will give us best results. Because at that point of time, patient will have preserved performance status. The chemo damage is not much. So they are in best shape to take a bone marrow transplant. So same is with the other disorders like non-cancer disorders, like sickle cell disease, like thalassemia. So it is a kind of curative treatment that we offer in sickle cell disease. So if offered on time, if it is offered to children who are say less than 10 years, the results are best. And we can say about 80% of patients are cured.
A bone marrow transplant, also known as a stem cell transplant, is a medical treatment that replaces your bone marrow or your blood with healthy cells. It treats blood cancers such as multiple myeloma and leukemia. It also treats non-cancerous conditions such as sickle cell anemia.
The commonest disease in Kenya today is sickle cell. We have a lot of children in Kenya and adults as well who suffer from this blood disorder called sickle cell. And they can actually benefit from bone marrow transplants.
Medical tourism has been on the rise, with most cancer patients traveling to India to seek cancer treatment.
Just looking at bone marrow transplants in general, a lot of people have been traveling out of the country because we thought we could not be able to do it. Until Tanzania, our immediate neighbors ended up doing their first bone marrow transplant. So there is something that is a little not correct with us to the extent that we are now allowing Kenyans to travel out of the country to seek services elsewhere for things that we can actually do locally.
According to the hospital's management, a bone marrow transplant costs between 2.5 million to 3.5 million shillings, which will be lower than traveling out of the country.
The government should be able to start facilitating these services in country, build infrastructure that can support care. Because what do we need for a bone marrow transplant? It's basically some simple infrastructure that allows positive pressure. So we have 2 types of pressures that may be essential, generally when you're managing a patient. If you're not dealing with negative pressure, you are dealing with the positive pressure, because the rest is routine room temperature and routine pressures.
The introduction of the treatment is likely to relieve Kenyans of the burden of travelling abroad for treatment.